Dear friends, welcome once again in the teleconference of Certificate in Healthcare Waste Management. This is our second session. In our previous sessions, we have learned about the infection control precaution in various areas within the healthcare facilities, where we have learned like what are the precautions need to be taken in ward, mortuaries, and operation theatre, etc. In these sessions, we are basically going to discuss about the sharps in hazards and how to take precaution about it, and spill problem, as well as post-exposure prophylaxis. How to take prophylaxis once a person is get injured. So I won't take too much time, and I would like to request Dr. Sumati, please continue with the previous topic.
Thank you, Dr. Vipla. Welcome back, viewers. And we are still left with a few important points in infection control practices. And let's move on to the sharps management. Now, the sharps in any healthcare setup constitute only about 1% of the waste volume, as you can see here. But the infectious hazard that comes from a sharp injury is about 90%. So they are very important, although they are a small part of the waste. Now, sharps could be any of these mentioned over here. The picture shows needles, the blades, and scalpels, etc. Now, to handle sharps, there are certain rules that we have to follow. The used plastic syringes, needles, and sharps, they must be placed carefully in puncture-proof containers and disinfected by chemicals or physical method, which may be autoclaving or use of hypochlorite, sodium hypochlorite solution. Alternatively, they may be destroyed by a needle destroyer, and the sharps container should not be overfilled, and it should be replaced by a new one when it is 3/4 full. And one must wear heavy-duty gloves and take care while transporting the sharps. This is for the healthcare, the waste handlers. And always dispose of your own sharps. Never pass the used sharps directly from one person to another. During exposure-prone procedures, the risk of injury can be minimized by ensuring best possible visibility. So you should have adequate lighting and visibility, and protect the fingers from injury by using forceps instead of fingers for guiding and suturing. Never recap, bend, or break disposable needles. And after use, place the needles and syringes in a rigid container, also called as a puncture-proof container, and not in any other waste container. So if one follows all these meticulously, then there should not be any danger of handling the sharps. And the sharps containers for the sharps should be located close to the point of use. This is important because the person should not walk any length of distance to discard a sharp. And send the sharps container for disposal when it's 3/4 full. We've already mentioned that. And 1% sodium hypochlorite can be used if a needle cutter is not available. And pick up open needles with forceps, not with the fingers. Destroy needle tips by burning if the cutters are not available. Now, here it's important to mention about recapping of needles. Although I have mentioned, I think once or twice earlier in the earlier slides, I did mention that recapping of needles should not be done. But sometimes it may be required to recap the needles, and if this is the case, then one has to follow a rule for that. So please take a look at this picture here. Recapping of needles can be done by these 3 steps. Place the needle cap on a hard flat surface, and with one hand hold the syringe and use the needle to scoop up the cap, and when the cap covers the tip of the needle, then use the other hand to place the cap firmly on the needle hub. So this way we can ensure that needle stick injuries do not occur, and recapping can be done in a safe manner. Although again I must insist here that recapping as a procedure should not be done as far as possible. Now coming to the topic of needle stick injuries, also called as NSI. So they are injuries that one gets as a result of a prick with a sharp instrument. Usually it is a needle. So for this there are established protocols, and every hospital should establish its own protocol for needle stick injuries, and there should be a method of accident reporting in the hospital. So every healthcare worker should be told about the importance of needle stick injuries and that they should report it. First aid and immediate action should be taken. The finger should not be put to the mouth as a reflex. The source status of the HIV for HIV, hepatitis B or C should be known of the patient. And one should assess the post-exposure prophylaxis requirement present in the hospital. So here, most healthcare workers feel that needle stick injuries are part and parcel of their work, and it should all be taken in their stride, and there is no need to report it. But studies have shown that it's extremely important that needle stick injuries are reported and an accident register be maintained, and ideally every healthcare worker should be trained to report accidents of this sort, that is needle stick injuries, and appropriate post-exposure prophylaxis also has to be taken, especially in the wake of the HIV/AIDS epidemic and hepatitis B. The dangers of transmission of these infections is pretty high in the healthcare setup. Now, coming to another important aspect, that is spills handling. So whenever there is a spill of infectious material, use gloved hands for handling the spill and cover the spill with paper towels, blotting paper, newspaper or any absorbent material, and 4% sodium hypochlorite should be poured over the spill. While I mentioned that 1% sodium hypochlorite is sufficient for disinfection in other instances, in spills a higher concentration of sodium hypochlorite is preferable to be used, 4%, and it should be left for about 30 minutes, and then it's removed with an absorbable paper towel or cloth, and this should be discarded as infectious waste in the yellow bag, which is sent to the incineration. So that is the method for handling spills. And now coming to precautions in transportation. Covered trolleys should be used for intramural transportation of segregated waste in secure bags. Now, intramural transportation is the transportation of waste that occurs within the hospital, whereas extramural refers to the waste transport outside the hospital. The trolleys should be labeled with the biohazard symbol. Proper labeling of the waste bags should be there, and do not transport infectious waste along with the general waste, because there are chances that there could be mixing of the waste which is not desirable. And what kind of a transport vehicle should be used? The vehicle should be dedicated for the purpose. Inside the vehicle there should be minimum joints and sharp edges, because that makes it amenable to cleaning, and display the biohazard symbol on the vehicle, and preferably it should be a closed vehicle, and the inside of the vehicle should be cleaned periodically. So this is a picture of one of the transport vehicles that could be used, and this is for extramural transportation. Of course, for intramural transportation we have the wheelbarrows, trolleys, chutes, and this is the ideal kind of a transport vehicle for extramural transportation. You can see that it is a closed kind of a vehicle with space for the waste material. And the important issue of accident reporting, although I have mentioned it earlier, one has to report all accidents concerning waste to the waste management officer, and it should be placed on record in an accident register, and senior staff in charge should also be informed, and appropriate corrective measures must be taken. For example, the post-exposure prophylaxis and other measures for vaccination of hepatitis B, for example. All these measures can only be taken if the staff are vigilant enough to report any kind of accident that happens in course of their work. Now, post-exposure prophylaxis, the risk of infection after exposure depends on the amount of blood involved. For example, if it's from a blood bag, blood donation, in the blood bank, the amount of blood involved is quite a lot. And it also depends on the amount of virus in the patient's blood, and whether post-exposure prophylaxis has been taken within the recommended time. So these are the three important aspects to be noted in any exposure, for example in a needle stick injury. So what does one do after a needle stick injury? Wash the area with soap and water, and any splashes to the nose, mouth, skin, etc. should be flushed with water. And if it's a splash to the eyes should be irrigated with clean water, saline or sterile irrigants, and the matter should be reported to the appropriate authority. And start the post-exposure prophylaxis if indicated, based on exposure code and status code. And this post-exposure prophylaxis should preferably be started within 72 hours. And testing and counseling of the exposed person is also very important. So with this, I come to the end of today's discussion topics, and here I would just like to mention in the last slide here, there is a book available which covers all these aspects of hospital-acquired infections and how to prevent them. It's called Hospital-Acquired Infections, Power Strategies for Clinical Practice. So it's waste management is also an issue that has been taken up in this book. So thank you.
Thank you very much, Dr. Sumati. Yeah, here we are ending first session, and we are really very much thankful that Dr. Sumati has explained a lot of things regarding the infection control precaution in various setup in hospitals, especially the sharp injuries as well as the prophylaxis. The most important thing is wherever a person is report any injury or any accident, please don't forget the counseling aspect of that person, because taking medicine is not only the solution. That person may go under tremendous condition of some mental trauma or some kind of things. In the other way, the person may be just reluctant, also thinking that okay, these are the part of my means day-to-day practice, so it may be happen. So both are the things you have to take in consideration and give a proper counseling of that person who has reported along with any accident with sharp and some other object. Now we are looking forward for the second sessions, and in these sessions we are going to discuss about the environmental practice for healthcare facilities. And to discuss these sessions, Dr. Megha Rathi will be Dr. Megha Rathi is with us, and I request Dr. Megha Rathi to discuss about the environmental practice for healthcare facilities. Dr. Megha, please.
Thank you. Thank you, Dr. Sumati. It was a wonderful presentation, and really gained a lot out of it. And the next topic that I'll be taking for this session is environmental practices for healthcare facilities. As all of you have known, you've attended your earlier teleconferencing and this teleconferencing. We're trying to cover as much as we can from your curriculum. So we've already done on basics of segregation, treatment technologies and infection control. Now it's just to highlight on what are the environmental practices that are there beyond, if you have achieved segregation, and maybe you're ready to take forward some steps which can help the environment in general. So this presentation would kind of just highlight on that. And this is coming to the first slide, scavenging of waste. This has been a common sight that all of us have come across within the hospitals, outside the hospitals. And up till now, I mean, straight from when I can gain consciousness up till now, I just see this, this is a very common sight. Though we have the regulations in place, we are improving. I'm sure this is improved in many places, but it's still in a phase where we are improving. We have a lot of waste that's scattered around, and problems because of scavenging. And then the next slide is open dumping and burning of waste. This is, as I said, that you have open dumping of waste. A lot of waste is just lying outside the hospitals. The easiest method that was practiced is just burn it, not regardless the kind of fumes that have been generated, how bad it is for our health. We just would burn it, or anywhere, maybe just in front of the hospital, in the terraces of the hospital, in front of our homes. So the fumes that are inhaled by the healthcare worker and the general public were immense. So this is called as open burning. And then the next stage that we came across was using of single chambered incinerators, which was just a closed furnace. Instead of open, it was a closed furnace. And then considering the environmental standards, the incineration came into a double chambered pyrolytic incinerators came into existence, which have their own problems the kind of emissions that they have if we don't have proper scrubs and pollution control devices. So we've actually been addressing this problem of environment and health from the very beginning. We've tried to sophisticate on the technologies that we use, but we're still a long way behind. And then the next slide, that is on the reuse of hospital waste. This is again a very, very common practice. We've seen a lot of syringes just lying across. People just come, collect them, repack them, and sell it back to us. Here, the second slide, you can see is a lot of gloves just lying outside the hospital. A vendor is just selling them. So it has been a very sad scene because people are very ignorant. The hospital staff as well as the communities are very ignorant about the problem of healthcare waste management. They just tend to buy things which are cheap, regardless whether they are sterile or non-sterile, does not make a difference to them. So these practices have been followed. So I guess the awareness level that's there is very less amongst the general public, and though it's developing within the communities, healthcare professionals. But we still see a lot of waste that's been pilferage, a lot of waste that goes out of the hospitals to the community and without sterilization, without disinfection for reuse, and it's actually coming back to us in the form of infections that we've already discussed. Dr. Sumati has discussed hepatitis B, you have HIV, and all kinds of infections that are coming because of the bloodborne infections that we have because of lack of sterility and sharps waste. So how do we overcome this? This is a figure that I came across today. Was chronic diseases linked to hazardous chemicals are on the rise, including certain cancers, birth defects, learning disabilities, fertility problems, autism and asthma. Total annual cost of environmentally attributed diseases in American children alone is more than $55 billion US. So we see that because of the lack of commitment that we have to environment, this is the burden of cost that we have. And then how do we overcome this burden of diseases? What should be done? The next slide. Can we have a focus on the next slide, please? This is on the sustainable hospitals. So what is the concept of a sustainable hospital? How will a sustainable hospital help us overcome the problem of healthcare waste management, hazardous chemicals that have been used? So it's a sustainable hospital concept is the hospitals, or rather the healthcare facilities, are those that select products and work practices that eliminate or reduce occupational and environmental hazards, maintain quality patient care, and contain the cost. So at the same time where we are managing the environmental hazards, occupational risk and the patient care, we also are looking at containing the cost. And so this is what is a sustainable hospital. How does a hospital sustain itself in terms of healthcare waste management, environment and the costs related to it? So the first step that any good hospital or healthcare facility would have is the segregation of waste. The slide here shows this is the first most basic step and the most important step for healthcare waste management is segregation of waste. Until and unless we do not segregate our waste at the point of generation, we are not going to solve any problem related to waste management. If we are mixing waste, it's been segregated later on, we are just increasing the volume of waste. This is the first point here is minimization, waste minimization. As Dr. Sumati had highlighted, it's only 15% of the waste that is actually infectious in nature, and if we don't segregate the waste, then the entire the entire volume of waste gets to be infectious. So we're only increasing the cost of diseases, increasing the cost of treatment, the burden of diseases. So segregation is a key to any waste management procedure. And then, as I had highlighted, we have come across alternative technologies also that we have seen, which are most prevalent in our hospital settings. Here is an autoclave, a waste autoclave, or a waste microwave. You have an hydroclave. You have different kinds of alternative technologies that are available. Alternative technologies are those technologies, as all of you know, which are non-burn technologies which do not use s- uh, any fuels in it, I mean burning technologies like incineration, and they're environment friendly, they are sustainable within the hospital, they're user friendly, you require less cost, less maintenance, and finally the output is like you have a very good sterile waste that is there which can be reused, and at the same time it is minus environmental hazards and pollution. And what are the key for waste management practices? What is the key for your waste management practice here? Waste management practices, as Dr. Sumati had highlighted earlier, was waste management policy and commitment within the healthcare facilities would be a key to the waste management practices here. If you have a waste management policy which says, specifies the steps for waste management, this is the first step, what are the roles of different healthcare workers, who's going to be responsible for what is the kind of transportation that we have, the collection system, the treatment technologies, and if we achieve the first step, what should be the second step. So the policy is the key, and for having this policy in place, we need a waste management committee. So the waste management committee essentially comprises of all the key stakeholders in the healthcare facility, including the head of the institution, dedicated person from the infection control, and you have all the nursing in charges, you have the nursing in charges, doctors, administrators, waste handlers, everybody are a part of, the key persons from all of them are a part of the committee, who thereafter look into what all has been done in their divisions. And then regular training and monitoring is something that we have seen has been very important. If there's lack of training and monitoring, the system actually collapses. Even if a system like, a scale of Safdarjung in your hospital is a very big hospital, but in case of, if you don't have proper training and monitoring, then I'm sure it doesn't work well. So it's a regular.
Yeah, in fact, I wanted to mention here that in our hospital, at Safdarjung Hospital, being one of the largest hospitals, we have one of the CMOs, that is the Chief Medical Officer, who's apart from the routine duties, the person has been allocated only for waste management in the hospital. Okay. So that person,
because also the rules also specify that you need to have one person who's in charge of the waste management. So
she of course has people under her who carry out the thing, but then taking regular rounds of the hospital to see that the waste management practices are in place. I think you need a person who has to be dedicated to that.
So what about training and monitoring is an ongoing process?
That's an ongoing thing as part of this program only. So this particular person who's in charge of the waste management thing, she from time to time they organize these training sessions at all levels of healthcare workers.
Well, that is exactly.
I think not only the policy level, policy level is definitely very much important, but there are many guidelines, many policies in various hospitals, but the person who are working, they have to be self-motivated.
Committed, they have to be committed.
Earlier presentation,
that can only come with repeated
that's how training and monitoring. And that I guess that's where, because if your senior staff is just saying you have a CMO who's committed to it, so that probably gives more motivation to them to do something that should be good. And then after we have achieved this basic, coming back to the slide, future plans and sustainability. This could be a second step wherein we have achieved basic segregation, collection, transportation and treatment, and now our healthcare facility is ready to move on to the second stage, where it could be eliminating mercury from the healthcare facilities, looking at better sharps management practices, and how do you sustain them forward. And this all, everything in place can actually work very well if you have an environmental regulation, like the biomedical waste management and handling rules in India make India the key player in terms of healthcare waste management in the subcontinent. It's not, only Thailand is the other country in the SEA region where we are offering our program that they have a regulation in place. It's only India then which has a regulation in place, and it's far ahead of the other countries in the region. So this is how, with the commitment of the healthcare facilities and the government, I think so could put together, we can have a very good environmental practice within waste management and other environmental practices within our healthcare facilities. The future plans, coming to the slide, is an enhance worker safety, enhance patient safety, environmental sustainability, waste minimization, and standards for better health care. So this is already has been highlighted, by in Dr. Sumati's presentation, is worker safety, patient safety are a key to infection control. And so here I would just be covering them again, just briefly covering them here. Worker safety is very important, that to have worker safety we should be providing them with proper protective gears. There should be regular medical examinations for them, and you should also check on the immunizations that are available. Have they got them, or what are the status of your healthcare workers actually? Other than also providing all this, what is the status of the healthcare workers? If he's has any medical problem, should he be put on to a duty like this, or he should be taken away from this? And also, other than providing this, as it is, this shift from to safer chemicals and technologies. Like as I mentioned earlier, incineration is a technology which has been over and again. We found that there are many problems associated with it, environmental problems, health problems associated. So it's on a phasing off stage. It's only now that we limit incineration to a very specific kind of waste, and rather than earlier where all kinds of waste was being put into it because of the problems that it has of dioxins and furans and burning of plastics. So now that shift from non-burn to burn that you have, and also the chemicals that we have. You're seeing that mercury, in the earlier teleconferencing that we had, this mercury was taken up separately as a topic, and a lot of problems. I don't want to highlight them again here. So we are shifting from mercury to non-mercury based products and use of friendly technologies. Now, the next thing is worker safety is very important, occupational safety, but we cannot neglect the patients who are visiting the hospitals. In a hospital, in a healthcare facility, it has to be the patient, it has to be equal emphasis is given on the patient, so that they don't get your hospital acquired infections or any other any psychological traumas or anything that they have within the healthcare facilities. So what are the different areas that we need to highlight when it comes to patient safety? The basic areas that we need is injection safety, so that that we don't use common injections. Proper injection safety precautions are there in place. Blood safety, you have rational drug use, you have a good nursing staff there, and they're not exposed to chemicals. Clinical procedures are such that are they are patient-friendly procedures. Medical devices and equipment that are used are also the same, and then the immunization safety. Now the environmental sustainability. To achieve the occupational safety and the patient safety, there are some steps which some measures that we have to take in terms of having a healthy environment. So coming, as I said earlier, is ensuring basic waste management practices. We need to ensure that all the waste management practices that are followed, all the basic waste management practices are in place, and then we could probably move forward to choosing environmentally sound waste management system. And then the purchase policy again is important. That after all this, then there's a purchase policy which we could highlight on. If we have a study that is there in the hospital, it shows that the hospital what are like coming to an example of St. Stephen's Hospital here, which is, and the Max Hospital, who are now switching over from mercury to non-mercury based sphygmomanometers and thermometers. This is based on the study that they had in the hospital in terms of the hazards that are associated with mercury. What is the burden of disease? What is the cost that the hospitals are putting into buying mercury devices, and then what are the health hazards to the healthcare workers and the patients. So after analyzing all this, then a purchase policy was highlighted, wherein the mercury that is used within the hospital will be sent back to the vendors, and in place of buying new mercury devices, they would probably be shifting to non-mercury devices. So that's using clean and healthy alternatives. And then it is a clean and healthy surroundings that we have. We should have as you know, because we're looking at, there is a WHO figure that I came across saying that almost 20 to 30% of infection control diseases in hospitals are due to lack of proper sanitation that we have. So it's looking into proper sanitation and water supply. That's essentially very important for a healthy environment. In a country like us, where we probably are not being able to achieve good waste management practices, but at least we can, you know, focus on proper sanitation, water supply to the healthcare institution. It's extremely important here, because there are diseases that are spread through waterborne diseases that are there. So it is important that we have a healthy and a clean surroundings. And then very recently, it has also been linked that climate change again has been linked to health. So looking into all this, it's very important that we as a health care professional, or as a patient or a visitor, look into the environmental sustainability within the healthcare facilities. Then coming to the waste minimization policies, this is being practiced in most of the healthcare facilities. This is the first, I think, so basic step that is there for environment, you know, controlling the link between environment and health. Maybe here again, other than waste, is bulk purchasing. How do you reduce the waste that has been generated in the healthcare facilities? So first is bulk purchasing that you have. You can, you know, rather than buying individual stuffs, the hospitals and the healthcare facilities could go in for bulk purchasing. So that reduces on a lot of packaging material. And then the hospital and the healthcare facilities could also have certain policies that are there, and people are aware of environmentally conscious using double-sided printing and xeroxing. And they could also be, you know, a way where they could, you know, justify using single-use versus reusable, where it's essentially important you could use a single-use disposable material, or otherwise you could, you know, switch on keep using your reusable ones, which could be disinfected and sterilized very well and could be used back. As Dr. Sumati said earlier, was using gloves. You have your gloves that could be sterilized and used back, and also your vials and for collections. And rational drug injection use. This is something which the healthcare professionals have to look into, is rather than just, you know, we've come across where just doctors or rather quacks just couldn't just given injections for no reason. That's just increasing on the bulk of waste that's been generated. So rather than just giving injections for no reason, there should be a rationale for giving an injection. If possible, if a disease could be cured by just use of drugs, I mean, there should be a rational drug use policy in the healthcare facilities, and reduce use of injections within the healthcare facilities. And then the alternatives, when it comes to environment, there are certain products that are directly related with the environment and health. This is PVC. You have the PVC products that are used in the healthcare facilities, especially the blood bags, the IV bags, the IV tubings, and where it has been seen that a lot of phthalates that leach out of the blood bag into the blood and then into our blood streams. So there has been provisions where, especially in the ICU and the neonatal ICUs, where there has been a switch from using PVC to non-PVC products. So it's more on a critical area where it could be, you know, the phase off for these alternatives, where we're looking in for alternatives for these products. It could be in a phase off stage, you know, wherever it's essentially important, though we know that it's very dangerous or hazardous for us, but then it should be, you know, it should be justified. First, it should come to the critical care areas where the patients are really suffering, and the neonatal areas. So, and then and then to the glutaraldehydes, where there's a lot of exposure from glutaraldehyde to the healthcare workers. Laboratory practices I won't highlight here because it's already been done in detail by Dr. Sumati. And latex and gloves that have been used, mercury, these are some of the areas that the hospitals could actually look into and have an alternative purchase policy. Alternatives are available which are cost effective. The hospitals could go in and look into alternatives, because they are not only which would help them or help their healthcare professionals, the patients, and also reduce on the cost of treatment, needles and sharps and building material. This maybe I could just I have some special other slides that they'll follow which will highlight on these areas. Integrated waste management is the first slide here. We have seen that a lot of chemicals, pesticides, disinfectants and other volatile inorganic compounds cause a lot of indoor air pollution and other problems within the healthcare professionals and the patients. So and these pesticides and all are mostly used to keep the insects away from the hospitals. So rather than using these, we probably could switch on to alternatives which are organic in nature, which will probably eliminate the indoor air pollution problems and provide a healthier environment within the healthcare facilities. So these small initiatives, they are small initiatives which probably they could go a long way to the healthcare workers within the healthcare facilities. And then because we've come across a lot of allergies that are there within the healthcare professionals due to these chemicals and the disinfectants that have been used, and they are also at times carcinogenic in nature. And similarly, point here is the antibiotic policy within the healthcare facilities and also outside. Here where I mention outside, here I mean that you have food that is made up of where you use a lot of pesticides. They're not organic. It's not organic food, but the inorganic food that we're using in the healthcare facilities. So the healthcare professionals could actually look into alternatives where the food that has been that's supplied to the hospital has a more organic source in it rather than the inorganic content. And then the healthy buildings. This is a concept that is actually a very new concept that is coming up. We have a couple of healthcare institutions in India which are new buildings that are coming up with this concept of healthy buildings, wherein they're trying to eliminate as much as toxic substances they can from within their buildings, with the flooring, the paints that they use, the material that you have. You could reuse the bricks that they are using, they are actually reused, energy efficient buildings. So these are some of the topics that which have to be considered when they are probably looking into the new buildings within the healthcare facilities. They are incorporating healthy design elements so that a lot of daylighting is there. Here again we are saving on a lot of energy in terms of electricity that we use, and innovative technologies. Now you have a lot of CFLs and all that are available, though they have some content of mercury in them, but they're much less than the conventional bulbs that we use and the tube lights that we use. So it could be switching over from the more energy consuming to less energy consuming alternatives, and also looking into water harvesting. And you have water treatment plants and water harvesting. So how much are we saving on electricity and water? I think so that's something that is very simple initiatives, but which are going to be very useful. And then reducing on hazardous chemicals, that has been already talked on. And green operations ranging from organic food to housekeeping, I've done that. And solar heating, this could be something which the hospitals could consider to reduce on the electricity bills. And solar heating, you could have autoclaves that are run on solar heating, you could have boilers, and then reusing the whole energy, the electricity here. And the next slide is on just covering on 2-3 areas. If we have time, can I just, or I'll just hurry up then. Sure. This is on glutaraldehyde. This is, as I've already mentioned, so I'll just brush up. It's like glutaraldehyde is it's a known skin irritant, and it causes occupational asthma and respiratory disorders. So probably we could look into alternatives for glutaraldehyde, or rather than or also reduce the limit that is there. That's 2 ppm that's prescribed right now. Maybe we could go lesser than that. Yeah. So it could be some such steps which can be taken in the hospitals. And I also guess that glutaraldehyde is pretty expensive. So if you have other alternatives which are less expensive and also at the same time are occupationally safe, it would be a good idea to have them. And then latex allergies are very well known. So here a lot of healthcare professionals and the patients come across with allergies due to latex, and at times, you know, maybe it's not a latex allergy, but it's also confused with the powder that has been used in the gloves. So we could maybe substitute with the powder, could be the amount that's used can go down, or you know, such small things while we're doing purchasing. The facilities can look into such matters, and also the gloves that they're using should be proper fitting gloves. They come across casting of the skin happens because of the gloves that they are using. So it could rather than, you know, while doing the gloves that they're using should be a proper fit glove. So it could be step by step, as I'm saying, you cannot have everything in one day. So it could be, you know, step by step. You could have one step first. Maybe you can eliminate mercury, then you can look into glutaraldehyde, latex. So this is how we, and healthy buildings, switching over to CFLs, things like that, which could make the healthcare practices more environment friendly. Just not only when we're talking about when we talk about it. Now we only correlate waste management and with healthcare facilities in terms of environment. So it could be more than waste management that the healthcare facilities can do for the environment. Environmental friendly practices, which are recycling, reuse and reduce, energy and water conservation, waste minimization, non-burn technologies. And also after we've achieved all this, some could be also looking into zero waste. Whatever that we are generating within the facilities could somehow be recycled, reused, and then there's no waste that's been generated within the healthcare facilities. And coming to the last slide here is like, you know, the alternatives that are there. You have digital thermometers, you have CFLs, and this picture, I don't know whether you can read that, it says cancer treatment centers built without materials linked to cancer, pediatric clinics free of chemicals that trigger asthma, and hospitals with healthy food, fresh air and sunlight. So this is, I think, so something we are looking beyond waste management from the healthcare facilities. So I'm sure we can take small initiatives and achieve something. Thank you.
Yeah, thank you very much, Dr. Megha. I think Dr. Megha described very well in a very descriptive way these environmental hazards of the healthcare facilities, and it is the matter of the improvement, because still we are in a development phase, we are in a developing phase. So overnight is not a issue, but the thing is we have to improve by stepwise, as she mentioned. Like first thing maybe like the mercury, and later on maybe the like healthy building, and all these things need to be taken care.
Yes, if I may just add, sure. There is what's called as the hierarchy of controls. You have to try and follow that in order to, you know, it's a kind of a holistic approach where the hierarchy says the 4R factor. That is, firstly you try to reduce using something that would result in becoming a waste. So if you cannot reduce, for example, instead of using an injection, you can give it in an oral form, the drug. So that way you can reduce generating waste. If you cannot reduce, you at least try to reuse the waste. So you use the thing, but you try to reuse it. And if reuse again is not possible, then you try to recycle it. That means after you discard, you in some other form you can recycle it, and so that you get back from it.
I think, sir, madam, in this case, like reuse may be confusing along with the many people again reuse their syringe, needle. That may be the matter of the confusion, but these things should be taken care very
for different instances.
Yes.
And if you cannot recycle also, at least try to recover energy from it. For example, people are even looking at, you know, the incineration requires a lot of temperature rise, and it's something like 800 degrees and more than 1,000 degrees centigrade at the primary chamber, I mean in the secondary chamber and all that. So that much of heat can be used for, you know, to recover the energy for heating up something and all. And so like that you have to try and recover, and the final thing should be to dispose of a waste.
I think our student must be benefited by this discussion. Here I would like to say thank you to Dr. Sumati as well as Dr. Megha. I would like to say thanks to all the regional directors and our students, and at the last I would like to say thanks to our EMPC team who has helped us to disseminate this information to all our students. Thank you very much to all of you.
Thank you.